Hi, it's Cecily with Revival Nutrition and Health. Well, a couple of days ago, I announced that I was going to be launching a new video series called Tuesday's Truth. And each week, I'm going to highlight a new truth about chronic digestive issues that I think you need to know. And I'm also going to be answering questions that I think your GI specialist or your gastroenterologist is almost certainly not answering for you. I want to hop right in with what I consider to be a pretty big foundational truth. I'm going to be explaining to you why, if you've visited your GI specialist for some sort of chronic digestive issue, that you've almost certainly walked out with a prescription for medication. And in fact, if you have been diagnosed with inflammatory bowel disease, that medication is expected to be taken for the rest of your life. Let's take a step back though. What we have to say first is if you have visited your GI specialist for chronic digestive issues, I'm going to make the assumption that you've probably had some digestive issues going on for a while, maybe a few months, maybe a year, 2 years. I have clients, in fact, that have had digestive issues for 20+ years. And when we look at chronic health issues in general, which includes chronic digestive issues, one of the major contributing factors to chronic health issues in general is inflammation. So for me, the big question becomes, what is causing the inflammation in the body to begin with? The diagnosis is great, but we have to know what's causing these issues. And I'm going to explain to you exactly why your GI specialist is not able to answer this question and instead decides to give you this prescription medication. So in order to understand why your GI specialist cannot address this issue of inflammation and instead reaches for the prescription pad to write a prescription for a medication, we have to take a look at some numbers. I'm not a numbers girl, but this is super simple math. So let's look at some statistics. These are from 2018, so just keep in mind that those numbers have certainly increased. More than 2 million Americans have been diagnosed with inflammatory bowel disease. More than 35 million Americans have been diagnosed with irritable bowel syndrome. We have more than 20 million Americans that have been diagnosed with a chronic digestive issue. And there are more than 70 million Americans that have some type of digestive disorder. Let's flip to the practitioner side. That's important to hear too. As of 2018, we had between 14,000 and 15,000 GI specialists practicing. Now, it's important to note, though, that only about 13,000 of these practitioners are seeing patients. So what does this translate to? Well, the bottom line is that it translates to the fact that each person that visits the GI specialist has approximately 20 minutes to visit with them. That is insane. And I feel like that is the heart of the issue as to why you walk out with a prescription medication. There is simply not enough time. This is a time issue, it's a scheduling issue, and I think it's a systemic issue with healthcare in general. These physicians are actually really just overbooked, overscheduled. Now there is an absolute need for a GI specialist. I wholeheartedly believe that. They have access to diagnostic imaging that is really important. If we think about it for a minute, we can feel that something is not going on, that something is wrong with the body. We get cues from our body all the time. Our body is desperately trying to communicate with us, telling us things. And so even though we can feel things that aren't right in the body, we can't see them. And so this imaging that a GI specialist has access to is really important, and they can go in and they can see what does the inside of the body look like, what's going on in there. And that helps with diagnosing. And they're really wonderful at acute care and surgery. So there's an absolute need for them. But if we stop and go back to this question of what's causing the inflammation in the body to begin with, that's where I think it ends. And like I said, I don't think it's a lack of desire. I think it's a lack of time. Now, selfishly, I don't think that the fact that they're overbooked should be my problem. I think that It should never stand in the way of anyone's health and wellness. It should never stand in anyone's way of actually healing the body. And therefore, that means that we have to look at other solutions. So what are the answers? Well, I think one of the most important things that needs to happen is that in addition to your GI specialist, you should be seeking out another practitioner. And we're at a great and very exciting time right now, I think, where the number of alternative practitioners and functional medicine doctors is substantially increasing. And this means that we have access to physicians and practitioners that have the time that it takes to be able to do this deep digging into each individual's personal health story. I say everyone has a health story, and that story is packed full of information that's really valuable to us. And looking at the broader picture and figuring out what's going on inside the body and how we treat the root issue. These practitioners also have the ability to run really comprehensive specialized testing that I think is another huge piece of the puzzle. And when we're looking at getting information from the body to paint this bigger picture for us and put together a plan that is more specialized. So the last thing that I think is really crucial to understand about finding a practitioner to work kind of in conjunction with your GI specialist is that with this whole time theme that we have going on, they actually have the time to build really good, trusting relationships with their clients. And so what's so great about that? Well, I think it's invaluable because it's in those lengthy conversations where information comes to the surface. We are able to talk openly and honestly and without judgment so that we can hone in on these stories that are told. Well, when I was 6 years old, this happened. And oh, I remember when I went on this trip, I came back. All of these little pieces are super substantial in putting together a plan that gets people well. So that's really the bottom line. Finally, I would just say that you absolutely deserve to have answers. You deserve to have all of your concerns heard, and that you're going to have to search a little bit to be able to find a practitioner that fits your needs, both health needs and personality. And but there is somebody out there for you that has the time to dedicate to putting together a personalized plan exactly for you to get you well. And I'd like to also say that we're not married to any one practitioner, physician, etc. We are in the driver's seat here. We have the power to hire a doctor and we have the power to fire a doctor. So if you're not connecting with your physician or your practitioner, you need to say thanks and I'm moving on. And you need to go out, ask for recommendations. In fact, if anybody listening has a practitioner that they absolutely love, I'd love to hear who they are, and especially if they're a GI specialist, because I know they're out there, but I haven't been able to find them. So if you have someone in mind in the comments, please add that information for everybody to be able to see and take advantage of. I would absolutely love to hear your thoughts and read your comments on what you take away from this video. This, like I said, this kind of foundational big truth that time is not on the side of the patient when we're dealing with chronic digestive issues and chronic health issues in general. So if you have something to say, I would love to hear it. And of course, until next Tuesday, please be well.